All right. So thank you for joining the alumni panel for the AANMC's Virtual Fair Day. We have organized today in just a little bit differently in years past, given the Zoom fatigue many people have had. We didn't have it all back to back to back. So we've kind of spaced this out as a way of giving our brains and eyes a little bit more of a break. But today I'm happy to have alumni from our member schools with us, and really excited to see everyone here. And so this is just going to be an informal chat. I'll have a few questions that I'm going to ask each of the alum to jump in on, and then we'll take some questions, time permitting, from the audience. So I do ask that if you are in the audience that you just keep yourself on mute. Otherwise, it's going to be a big jumble of noise. So for now, I will just introduce myself, and then we can just go one after each other. And introduce yourselves, what school you're a graduate of, a little bit about your current practice in life, and anything else fun that you'd like to share. So I will start. I'm Joanne Yanez. I'm the executive director for the AANMC. And let's see, I have been with AANMC for 9 years. Prior to that, I taught and practiced as a naturopathic doctor, have served in a bunch of different capacities in different boards and organizations, and excited to be here, and have just recently relocated from California to Arizona. So that's a little bit about me. And Dr. Mandana, why don't you go ahead?
Sure. Hi, everyone. I'm Mandana Edelati. I graduated from the Canadian College of Naturopathic Medicine in Toronto. I have since moved to Vancouver, where I run a private practice in North Vancouver with a special interest in women's health, gastrointestinal conditions, and sports medicine.
Thank you. So I'm just going to go in my squares. Dr. Peters.
Yes, I'm Dr. Sean Peters. I graduated from the Boucher Institute of Naturopathic Medicine, which is now merged with CCNM, so now the Canadian College of Naturopathic Medicine as the Boucher campus. I'm relatively new grad. I graduated in 2019. I live on Vancouver Island and Courtney, and I've been practicing for just over 1 year. And yeah, I'm in a multidisciplinary clinic. There's a number of folks in our clinic. I don't really have a necessary specialty or focus of any sort. I certainly have a kind of a special interest in mood and mental health and skin conditions and a variety of things like that I focus on. And I also work for the Canadian College of Naturopathic Medicine as the continuing education coordinator for the Boucher campus, and do some other things in my other time as well.
Excellent. Thank you. Dr. Wattles.
Perfect. Hello, everyone. I'm Kalia Wattles. I'm a Bastyr grad. I graduated in 2017. I kind of have a unique working life at this moment, which is really exciting. I split my time between being on clinical staff at the Institute for Functional Medicine, so working in a nonprofit medical education organization, and then in private practice, specializing in fertility. It's actually really fun because both of these, both my nonprofit job and my clinic job, are really an integrative setting. So at our nonprofit, I work with MDs and chiropractors, acupuncturists, clinical nutritionists, and the same is true for my clinical practice, where we have an integrative setting that has MDs, NDs, chiropractic, physical therapy, massage therapy, acupuncture, and nutrition. So it's been really nice to integrate into those teams really flawlessly with our naturopathic background that really considers a lot of those lifestyle factors. And so excited to share more about how we can use our naturopathic training to serve both patients and to work in the nonprofit setting.
Thank you. Dr. Hines.
Hello, everybody. I'm Dr. Sean Hines. I am a graduate of National University of Health Sciences in Illinois. I'm a resident of Illinois, and I'm also the president of the Illinois Association of Naturopathic Physicians. And we live in Wisconsin also, so I go back and forth. So my practice is actually 100% virtual. So it allows me the freedom to go back and forth. But I do spend a lot of time trying to work on licensure for Illinois. That is one of my greatest responsibilities right now, I would say. And yeah, that's about it.
Thank you. And Dr. Quintana?
Hi, everybody. I'm Dr. Beth Quintana. I'm a graduate of Bastyr 2008. I have been involved in several facets of employing our medicine. I've practiced both primary and specialty care. I've practiced specializing in injection therapy, as well as various physical medicine modalities. I've also been a director of education and clinical support for a diagnostic laboratory. I've worked in an integrative pharmacy, providing guidance and education. I am currently a peer editor. I'm a consulting medical and scientific editor, which is fantastic. I get to review regularly recent research, and I don't have to do the searching for it. And I'm in the process of making a significant shift with my offerings into death care, death and dying, end of life education, advocacy. And my hope and my goal is to open up the conversation more, to normalize it. And from a naturopathic perspective, in terms of determinants of health, our spiritual self and care of our whole self and soul. I can't think of anything much more fundamental. So that's my calling that I'm moving into now. Thank you.
Thank you. And Dr. Barientos?
Hi, I'm probably the youngest of all the professionals here. I've graduated from Bastyr University, California, here in beautiful San Diego this past summer. And currently I am working for Naturopathic RX, which is a clinic located in Rancho Santa Fe. And my specialty is, I guess, men's health. Do primary care, a lot of post-COVID syndrome, but I generally center around jiu-jitsu athletes, MMA athletes, Muay Thai, boxing, and anything related to physical sports.
Wonderful. Thank you so much. So that is our panel. And if anyone else on our panel has jumped in and I missed you, feel free to let me know. It's just hard with all of the names here. So why don't we start with the first question is how did you end up doing what you're doing? Whether that is the specialty or the patient population, how did you end up in your journey as an ND? So Dr. Edelati.
So I essentially, my background is in psychology, and I finished my undergrad degree, after which I wasn't quite sure what I wanted to do. So I went into banking, decided that was definitely not for me. And I was essentially thinking of going into counseling, and then I came across the naturopathic medicine program. And what I really liked about it was all the different therapies that you get to use to treat patients, including counseling. So that's sort of what got me going and got me started on this path. So from a psychology degree into banking and now in naturopathic medicine.
Thank you. And Dr. Peters, and we can probably just keep the same order for ease.
Yeah, I became a nutritionist quite some time ago, a number of years before I ventured into naturopathic medicine. And I actually worked in health food stores at kind of various levels for quite some time before that, and found at some point that I was moving away from the nutrition aspect and the helping folks aspect to other parts that I didn't enjoy, and also found the nutrition aspect to be in and of itself just limiting, that it didn't offer enough of the tools that I wanted to offer to folks. And so at that point, actually, I decided to go into naturopathic medicine, which was on my radar for a while before that, but I didn't have an undergrad or anything before. So essentially that was just before I was 30, and spent the next decade or so getting getting all the requirements, including my undergrad and then going into naturopathic medicine. So ultimately just ending up allowing me to have more modalities in my toolbox to be able to help folks with.
Thank you, Dr. Wattles.
Perfect. Well, I think my path to naturopathic medicine, it's multifactorial, so I'll try to cover all the highlights. I just started seeing an ND when I was a teenager. And I think for many of us, we come to naturopathic medicine because of our own healing journey. And that was definitely true for me, that I saw this practitioner that was different from anyone else I had ever experienced. She was also an Ayurvedic practitioner, and that opened up so many doors. She encouraged me to explore Bastyr. So I ended up doing my undergrad degree at Bastyr, and then similar to Dr. Peters, really realized that, wow, I love nutrition, but I think I have so many more tools that I could utilize. So stayed on in the naturopathic program. And I think one thing that was really helpful for me during my training was that I had excellent mentors. And I can't underscore enough how important it is to have great mentors to guide you through your process. And so my mentors really encouraged me while I was a student to explore all these different opportunities, to do quite a bit of preceptorship, to figure out really what I wanted to do with the medicine, how I wanted to bring that and increase access to the patient populations that my heart really felt called to. So I ended up having 2 children during my ND program, and that really helped me understand how much fertility, pregnancy, postpartum care meant to me. So I ended up essentially cold calling the fertility clinics in my local area and begging them to bring me on as a preceptorship, even though I was kind of a non-traditional student, and they agreed. So I spent quite a bit of time in my local fertility clinics. And that really opened my eyes to this relationship that we could have between our, naturopathic medicine and our conventionally trained colleagues. And then during my naturopathic training, I was able to secure an internship at the Institute for Functional Medicine. So I kind of had these things going on simultaneously. And that really led to this dual kind of practice that I have with naturopathic and functional medicine, and a specialty in fertility care.
Thank you, Dr. Hines.
Sure. I've wanted to be a doctor since I was 11 years old, and that type of doctor kind of changed throughout the years. When I graduated high school, I joined the Air Force, and while I was in the Air Force, I was actually looking up a doctor. At the time, I wanted to be an MD, a doctor that specialized in natural medicine, and that's when I saw naturopathic doctor come up. So while I was finishing my prerequisites for medical school, I actually kind of changed directions, and instead of applying to MD schools, I applied to ND school. So that's how I ended up being a naturopathic doctor right after the Air Force.
Thank you, Dr. Quintana.
Hi. My journey to Bastyr and naturopathic medicine was, it sounds like, for many of us, not necessarily a direct path right out of undergrad. That was the case for me. In undergrad, I avoided math and science like the plague. I studied anthropology and religious studies. And really it was through experience. It was through also a sense of service and advocacy that I think really consciously opened the door for me. And it was specifically around women's health and education and informed consent. And so that really lit my fire. And gradually I learned about herbs and various choices with pregnancy and birth, and then learned about Bastyr. And because I did not get on an early track for pre-med, I spent several years working full-time and taking my prerequisites. And it was actually great because it gave me a reason to want to learn it. And I had a motivation, and I thoroughly enjoyed Bastyr, but it was a circuitous route to get there.
Thank you. And Dr. Barientos.
If you lived in the bad part of Los Angeles and never called 911 due to being into a bad accident, chances are you probably would have seen me picking you up in the ambulance. So I worked as an emergency medical technician throughout LA County. And after working 2 years, 911 calls, 24-hour shifts, 3 times a week, I quickly found out that over 90% of the phone calls, the 911 phone calls, had nothing to do with bar fights, had nothing to do with trauma. It was diseases being caused by choices people were making every single day in their lives, whether it was diet or how to manage stress or overworking, what have you. I quickly got burnt out, quite frankly, after these patients kept going to their primary care doctors and were being told, take this pill for the rest of your life. We're not going to address the root cause of your disease. Just here you go and come back when things get worse. Another event happened at that time as I was burning out, and that was my father was placed on Crestor due to having a cholesterol level of 800, which is unheard of. And they tested him 3 times, and all of them came back as 800 total cholesterol. And after they placed him on Crestor, he woke up after a week with yellow eyes and yellow skin. So that medication, which was supposed to lower his cholesterol, started killing his liver, damaging his liver. So luckily we found a book that recommended a naturopathic doctor, and through simple lifestyle changes, drastic lifestyle changes, eating organic foods, um, what have you, addressing the foundations of health, drinking 3 liters of water, glass, no plastic, bunch of fantastic changes to our lifestyle that his medical doctors made no mention of, we were able to quickly drop that cholesterol level within 2 months. So now that I'm in this field, I'm extremely grateful that I joined it, because diseases that I was taught in emergency medical technician school that were incurable are actually being reversed or cured. I got to be careful with that term. Shows me that I chose the right path.
Thank you so very much. So the next question I have is one we sort of asked on the student panel, but I like to ask it of folks who've gone through this schooling. If there was something that you could tell your younger self before you started the program, advice-wise, what do you wish you knew? What do you wish somebody had told you before you started? And Dr. Edelati, you can start first.
I think just sort of realistic expectations about the course load and what it all entails, the intensity of the program. I mean, it is a medical program, so it's expected to be intense, but I think I didn't go into it with that level of expectation, and it was quite intense. So I think having realistic expectations, whether you're going to be able to work or not. And some people are able to work part-time as they go through the program, but it is definitely more challenging. And then the other thing I'd say is early on when you start the program, it's always helpful to sort of form your own group of peers so that you can share information, take class notes, just to sort of make the process a little bit easier on yourself, and have that sort of peer support. So everything just sort of goes a little bit more smoother throughout the years.
Thank you, Dr. Peters.
Yeah, that's a good question. I'm trying to think about that now. I think the same thing that was just kind of stated is the level of intensity around what a program like that requires of you and draws from various aspects of your life. And I think the importance of supporting yourself throughout that in a variety of ways that allow you to maintain being grounded, and including, like supportive measures, either things that we use to support our stress response or that type of thing, but also, developing community within the program itself to kind of bridge or bring that support from your peers. I really like all of that.
Thank you.
Yeah.
Dr. Wattles.
Sure. So I have two things that are kind of coming up for me. I echo what the other panelists have said about just setting more realistic expectations. And along those lines, I wish I could tell myself, like, nobody learns everything the first time through. You're not expected to know everything the first time you hear it. And the thing I think about is, going through biochemistry, it was so hard for me to visualize how I was going to apply those concepts clinically. Like, how am I going to translate these biochemical pathways into a real human? But now, having been in practice, I can see that. So I wish I could tell myself, in retrospect, this is going to make more sense for the big picture. So just go and get the foundational understanding, and you'll be able to layer on some specificity and wisdom later. The second piece is, so just going back to my personal experience, that I had my first baby in my second year of the program. And at that point, I made the decision to stretch out my track to be 5 years rather than 4. And some ego part of myself at that point was, I don't know, frustrated with myself that I did that, but it really felt right for my family. And now, having some distance with school, no one cares. No one cares that I did that. And actually, I think it was better for my learning because it gave me a little time to slow down and really digest. And so I would give myself the advice to just be a little bit more gentle, give myself some grace, and know that in the whole scheme of things, adding an extra year that actually really benefited my level of assimilation in terms of the information I was being taught was really helpful.
Thank you. Dr. Hines.
Sure. I would definitely say self-care, really focusing on yourself and giving yourself time to relax. And I definitely didn't do that as much as I should have. You tend to let the stress get to you, and you're constantly focusing on work, and it's important to take time for yourself. And then another thing I wish that I would have done differently is I lived in the city of Chicago and the campuses in the suburbs in Lombard. And I did that commute every day, and it was very, very brutal. And it was so much added stress. So I would consider your commute and keep that as short as possible, live on campus if need be. And I also had a part-time job for a while. And I would also say that if you can avoid to not have a part-time job, that's definitely the better route. I know some people have to work a little bit, but if you can really just surround yourself and focus on your schooling, I would definitely do that if you can.
Commute time is inversely related to happiness. Dr. Quintana.
Very similar to Dr. Wattles, really on all points. I started off on the 4-year track at Bastyr and felt like I just want to get it done. And within the first year, I realized this is not sustainable for me, and I need to get over myself and pace myself in a way that I know is going to be better suited for my learning. And that also turned out to be a really positive decision. And I would remind myself, remember that you're laying down knowledge for a lifetime. And I would remind myself that little by little, like Dr. Waddle said, it will come to make more sense, and it will have more clarity for application. So overall, relax, trust yourself, and you're doing it, although it might not always feel like it.
Thank you. And Dr. Barientos.
The thing I wish I would have been told before entering naturopathic medical school, and quite frankly, high school, was to learn how to learn. At school, you're taught what to learn, but you're never shown how to learn it. And there are many fantastic resources that'll help you go through naturopathic medical school without just doing blind memorization, without just looking at a flashcard and flipping it over and over and over again. There's a fantastic author, he teaches celebrities. His name is Jim Quick, Kwik. He has the podcast, and he wrote a book called Limitless. I highly recommend that book because it teaches you different mnemonic devices to go ahead and remember vast amounts of information. So there are these people called memory athletes. These are people who take a deck of cards and they're able to memorize, shuffle it, and they're able to memorize the exact order of every single card using these special mnemonic devices. It's not just acronyms. There's way more special tools to recall information, especially when you get into ND school, because I mean, this past summer I had to memorize 180-ish herbs. I think it was over 200 pharmaceuticals, 80 homeopathic remedies, 60 orthopedic tests, and I don't know, over 400 items of different chronic diseases, diagnostics, treatments. The list goes on. So I highly, highly recommend you look into learning how to learn. There's even some TED Talks on that as well.
Thank you. Years ago, when I taught, that was anatomy and phys nursing students, I always started my class with know your learning style, because you don't have time, especially in naturopathic school. Like there isn't time to figure out how you're learning. You're expected to come to school knowing your learning style. So the last question that I have on my docket here is related to practice and practice success. And so you can either answer this from your own personal perspective or from colleagues that you've seen successful. If you could see one or two pearls to doing well as a naturopathic doctor, either from your own perspective or what you've seen in colleagues, what would that be? And so Dr. Edelati, you first.
So I'd say, you know, as medicine is an ever evolving field, keeping up with the latest research, you know, new studies, new therapies, I think those are really important to keep up to date with, and use the new developments so that we can better serve our patients and have better outcomes ultimately. But I think the other important concept is, and that's I believe it's an important part of any medical practice, is compassion. Patients come to see us because there's obviously some sort of disharmony in their lives, and oftentimes it's not just physical, there's a mental emotional component. And I think one of the first things that they can really benefit from is to be received with compassion, being heard, being understood, and just sort of knowing that there's someone there to guide them and to make them feel better. And I think that's a really important part of any medical practice.
Thank you so much. Dr. Peters.
Yeah, so I'm relatively new into practice and kind of figuring out what success even looks like. But for me, the two things so far that kind of come to mind are, one of them is find and utilize a mentor. Just don't necessarily think that you have to do your own clinic or have to do it on your own. I'm a big fan of learning from those who have come before me and wanting to be able to access, some wisdom and information that folks have. And so me finding the clinic that I now work at, a big draw was that it, other than being in the location I wanted and these other aspects of my life, was that there was someone there that could support my practice. And the second one is that I just love resources. I know a lot of people are drawn to different ways, but having clinical textbooks and my own treatment notebooks that I started in school and continued to populate, but having these things that I could go to as resources to draw on when there's a large number of things that you can do for folks, and knowing what can work and what should work for this or that type of thing is hard to know at times. So I'm a big fan of good clinical textbooks.
Thank you. Dr. Wattles.
Yeah, so I'll agree. Mentorship is everything. I am so grateful for the mentors that I have been blessed with in this life, because they really can give you a sense of confidence when you're new and it's scary. So mentorship is everything. I'll say a couple things just about what's worked for me in practice. So I think what I encourage students to do when I'm talking to naturopathic students is kind of think about, as you're going through school, do you want to do primary care, or do you want to act more as a specialist, right? Because we have so many of our colleagues do primary care, and I absolutely bow down to all primary care docs who have to know everything about everything. I knew right away that that wasn't for me, and that I wanted to act more as a specialist. So I have my specialty fertility practice, and it's been very helpful for me to find my niche. And so if someone feels called towards something specific, I'll really encourage them to really focus and niche down, if you will, and establish yourself as an expert in that field. So I'm a millennial, so I use social media quite readily. I'm a big fan of Instagram. And so by consistently creating content around my specialty, now I speak at conferences and I write in publications and I'm invited to be guests at different events around fertility, and it's really allowed me to network. And I think that this is important for a couple different reasons. For me is that number one, it's filled my practice. I actually just recently left my practice because I moved, but at that point I had an 8-week wait list just with fertility patients. And so that's great from just filling the practice standpoint. And then number two, it was only the type of patients that I want to see. And I know that that sounds harsh, but from a quality of life perspective, like I want to go to work and see the type of patient that makes me feel excited, that I want to research, that kind of gives me a little pep in my step. And so being able to fill your practice with patients who genuinely need help from someone that's an expert in a certain topic, I think is really rewarding in a bi-directional way. So I guess my advice is figure out if you want to do primary care or specialty care. And then if there's something that you feel really called to, just go for it and establish yourself as an expert in that topic.
Thank you. I always tell folks, like, what are the things that you research for fun? What are the things that you're just reading articles because you're interested in it? Though that's the area that you should go, because work isn't going to feel like work. It's going to be fun every day. So
precisely.
Great advice. Dr. Hines.
I would say when people start a practice, they think that you may get 1 million people in your door right away. And that's not always the case. It takes time to develop your patient population. And just getting involved in the community, getting involved with your state associations, your national associations, and getting on directories, and just getting involved is going to help your career grow and flourish. And then doing referral programs is another way, marketing, and just being involved in that stuff. Some people, I feel like they graduate and they're like, okay, now I'm going to start making money immediately, but you have to like grow, and it's a process in order to get your practice established. And I absolutely agree with, it's awesome to have a mentor. In the pre-licensed states, there are not a lot of mentors around. So if you don't have a mentor, don't be discouraged. There is so much information out there, and there's a lot of groups that you can be a part of and ask questions. So even if you were not able to have a mentor, it's not the end of the world. There's a ton of information out there, and you'll definitely be okay with learning and practicing and evolving. So.
Thank you. Dr. Quintana.
Yeah, I would encourage you to, in terms of the definition of practice, really expand what feeds into building your practice. It's a lot more than we might give time and attention to. And like some of the previous talks have mentioned, continuing education, voraciously reading about whatever it is that that you feel drawn to. Another big thing is being open to opportunities, especially first starting out. It really helps you determine what you like, what you love, and what you don't like, and perhaps what you might not tolerate. I've worked, based in Seattle. I've worked in Seattle as well as on the east side, which is Redmond, Kirkland. And so I've experienced different commutes. I speak really strongly to the impact that a commute can have on your ability to have a successful practice. And I've worked in a couple of non-clinical roles as well, which I was blown away at how much I felt like it was helping me become a better, sharper clinician. So I would recommend being open to opportunities and allowing both clinical and non-clinical experiences that you have be able to inform what you like and how you like to offer your medicine.
Thank you, Dr. Barientos.
So I'm brand new doctor. I just got my license this past month. So I don't know if I can offer very much advice when it comes to setting up a successful practice, but what I can offer is to be the doctor that you want to be treated by. I have a 10-year-old daughter, and in my case, I pursue my education in the framework of I want to be the type of doctor that I will take my daughter to. So I go ahead and I invest all the energy that's available to me and time to go ahead, like was mentioned earlier, to pursue my interests, read the scientific articles, read the textbook of natural medicine. For those who don't know, it's written by Dr. Pizzorno and a bunch of other naturopathic doctors. And quite frankly, that's the Bible of naturopathic medicine, in my opinion. Could be totally wrong, open for debate. But definitely don't be complacent. There's always room for improvement. Don't be satisfied with just binge watching Netflix or scrolling through social media. Every hour that goes to those specific things is an hour that you could have used to become a better clinician. And quite frankly, when you interact with people, they know if you put in the time to go ahead and be the best doctor that you can be. And it shows because patients want to be seen by you, or other clinicians want to work with you and network with you and set up business relations with you. So that would be my recommendation, is to be the type of doctor that you want to be seen by, or your daughter or son would want to be seen by.
That's one of the AANMC slogans too. So thanks for the plug.
Oh, really? I wasn't even aware. Oops, sorry.
Be the doctor you want to have. So I think we've definitely had some good questions come in here, and actually MUIH does not have an ND program. So I see a question coming in from David. There is not a naturopathic program at MUIH that's seeking accreditation. They were looking at one a number of years ago, but they did not do that. So anyway, if there are some questions from the audience, we will take those now. You can enter those into the chat. So question about insurance in California. I don't know if we've got a California doc here who can answer that. Sure.
The workaround that I've seen is, for example, Healthtopia, where I did my preceptorship, is you have medical doctors working with naturopathic doctors. And essentially, while the naturopathic doctor is seeing their primary care patient, at the same time, the medical doctor steps in, asks any questions. They kind of double team, essentially. That way, that office visit gets covered under the insurance. But for the most part, if you have your own clinic, it sucks, but insurance doesn't cover ND only visits if it's an ND only clinic, essentially.
Thank you. So there's a question about specialization in emotional and behavioral health, and just curious if anyone can speak to that.
I'm not sure about specialization per se. There is, or at least in BC, where there's the word specialization, and our scope doesn't actually allow for that. But as far as just focusing in a certain area, there's the Psychological Association of Naturopathic Physicians, or the Psych ANP, which allows further training in a variety of those concerns specifically. And I know there's a variety of other groups like that within the naturopathic profession. So that might be a particular avenue.
There are, and so the Psych ANP is a great resource. There are a lot of people. I know I talk about mindfulness. There are a lot of folks that incorporate the mental emotional component into practice as part of what they do. So even not necessarily a specialty, but just as part of providing whole person care, and recognizing how much the mental emotional component is really core to our overall health. So let's see here. Has anyone had any experience in working abroad? I see a question about going abroad. So for those, if you do have an interest in global medicine, the World Naturopathic Federation is a really good resource for anything globally health-wise. And so I would definitely say to check out the WNF and make sure that you see what they have for global practice. Scopes of practice do vary from country to country, so it's really good to check in with the WNF on that. There's a question for Dr. Barientos about your martial arts focus and how you got into that.
Sure. Can I add to yours really quickly about
Yeah.
there's also the Naturopaths Without Borders. That's with Dr. Sean Hessler and his wife, Sarah Hessler. They make trips to Mexico. I think they've made trips to Haiti as well. And they take students. I think every quarter they make a trip. So it's definitely something I would check out as well. But back to how to discover martial arts focus. I love being physically fit, and I think it's important as a man to protect my family. So when I took up jiu-jitsu, I quickly found out that the world's top athletes have never heard of us. So I made it a mission to go ahead and educate them about the power of our medicine, because these are athletes who every single day they compete. I mean, their nutrition is top notch, but when it comes to supplements or how to address their injuries, they're just almost next to ignorant when it comes to the tools that we can offer them to help their bodies recover and just be at an optimal state. So I made it a mission of myself to go ahead and use our medicine to educate them about that and just work with them. And they were super grateful, because I mean, our medicine is our lifestyle, quite frankly. And the fact that their medical doctors are not aware of the herbs that can help with physical endurance or low-level laser therapy to go ahead and help them with their injuries, it's just shocking. And we need to get in there and fill in that void.
So thank you for that. Yes. So I think I'm seeing a question about prerequisites and not holding a bachelor's or an associate's. So those types of questions would probably be better served with the school drop-ins that are going on right now. So if you have questions about prerequisites and college courses and things of that sort, the school drop-ins are going on right now. And so that would be a really probably better format to get those questions answered. So I think there's a question in every profession. So earlier this morning, I talked about Naturopathic Medicine 101 and, various different components of the, of our medicine, and a very high satisfaction rate across our graduates. But there is no perfect profession. There is no, there's no profession where 100% of people are happy with their choice. Sometimes people change their interests, or, things that used to be interesting to them no longer are, or they're learning new things about themselves. And so is there anything that, I think we all have components of any job, even jobs that you love that you don't love as much. So how do you work around those types of things within naturopathic medicine? And anybody can jump in here if you want to jump in.
Will you just summarize your final question for us one more time?
Sure. So I think every job has aspects that we don't love as much as other aspects. I know for me, it was charting. So how do you work around, I think there was a question here about, are there, for those who are in pre-licensed states, or, is it tough to be in a pre-licensed state? Like, what are the things that are a little bit harder about being an ND, and how do you deal with that?
I'll just share my perspective. So I feel very fortunate that here in Washington State, I have a big scope of practice. I think a lot of patients come and they don't maybe even realize I'm an ND, because I bill insurance, I can order labs and write prescriptions and do all the normal stuff, but then have this added layer of our naturopathic therapeutics, which is where we really focus our time and attention. But just as you mentioned, I found charting to be extremely challenging. I have a young family, and that wasn't, I was spending just as much time charting as I was in with patients. And so that's why it works really well for me to split my time between between clinic and then in more of a corporate setting, because for most of the week, I have, a 9 to 5 schedule. And when I am done for the day, I'm done for the day. And so I think that you have to think about multiple streams of generating revenue if that's what you need to do. Maybe you write, or maybe you also work in a corporate job, or maybe you work for a supplement company or a lab company doing education. There's all of these different options. And if you're holding multiple streams of revenue, then, maybe you don't feel so much pressure to do any one aspect that you're not loving.
Thank you. Anyone else want to jump in on that question?
I think also one of the things is, as you become a little bit more specialized in certain areas, I think it takes some of that time that you really have to, you still put a lot of time into each case, but because your experience over time with sort of more specialty areas, you can manage your time a little bit better, so you can have a better sort of work-life balance. And that's been one of the things that's really helped me over the years, because otherwise you can sort of get lost in just the work aspect and doing, longer hours and catching up with charts and whatever it may be. But having a more sort of specialized area, and it could be several areas, I think it helps better with time management and keeping a better balance.
Thank you. Anyone else?
I try to remind myself that there are a number of reasons why I wanted to become an ND, and my own self-serving happiness was a large part of it. And essentially it was a weight of balance that I made between, do I want to do the other job I was doing and career that I was on versus this thing? And this, like any other job, comes with a variety of things that I don't necessarily always want to be doing, but that on balance or on par, does it offer me more, or what I'm hoping to get out of my day? And that for me was at least a big part, and a thing that I try to remind myself about.
Yeah, and I think,
sorry.
Oh, go ahead, Dr. Walls.
Oh, I was just going to say that before I went into the ND program, I had another, an experienced ND who warned me, and I want to be really transparent. And she said, if you're going to be an ND, you kind of have to have some entrepreneurial spirit, right? I mean, I think a lot of people can maybe go out and find a job somewhere, but for the most part, we kind of have to carve our own path. And so just being prepared for that as you're going through school and thinking about what the after school life looks like for you will help you ultimately be prepared when it's time to go out there and perhaps be an entrepreneur.
Well, I think one of the things that I wasn't told when I went to school eons ago was that you didn't only have to practice clinically, but there were other options. And so I think for me, I only saw the clinical model, and even as a student, I realized I didn't want to be 100% clinical, but that was the only thing that I was seeing. And so, I think that there are, really tapping into yourself and knowing what your strengths and talents are, what your weaknesses are, hire out your weaknesses, get other people to bolster up where you're weak, do the things that you're good at and strong at. And have mentors to help you along the way. But yeah, I think that was the piece for me, was I didn't realize that there were non-clinical pathways. And, like you were saying, Dr. Wattles, of, kind of beating yourself up. I was beating myself up for a while of, well, but you went to school to be a doctor and you're not being a doctor. And so you're not being true to this education. But if anything, when I'm advocating for naturopathic medicine at a federal level, or impacting the trajectory of students' lives, I feel like I'm making such a difference. So that difference can look different for so many people, and really just what does it look like for you is the big question. So we're just about going to wrap up here, because I do respect the doc's time and I know everybody is super busy. Are there any last parting words that you would like to leave our students today on the fair before we wrap up?
Can I ask a question just about like rotations and like how much of like behavioral health or psychology did you guys spend as far as coursework or rotations?
There wasn't anything particular in the rotations at Boucher campus, but as far as counseling training or that type of aspect in the curriculum itself, there was almost as much counseling training as there was in other modalities that we learned about.
So I can share at Bastyr, so your last 2 years of the program, you're in the teaching clinic, seeing patients with the supervision of an experienced doc. And at Bastyr, there were a number of counseling or mental health oriented shifts. And if you felt like that was a real area of interest for you, you could pursue those shifts and kind of frame most of your clinical, your supervised clinical experience in those types of settings. And so, it's required for everyone. I think we take 2 or 3 quarters of counseling where we're seeing patients in a counseling shift where you are the main practitioner who's offering the counseling, and then a supervisor is kind of watching your interactions, giving encouragement and feedback. But if that really resonates with you, you could certainly pursue that throughout your clinical training and really make that the focus of your supervised encounters.
Did you guys learn about neuroscience at all?
There's neuroscience. So Chanel, I think some of these questions honestly probably will be better with the schools and talking to the round robin of schools. So I thank you though for your questions, and they're really good ones. But I think each school probably, like, you'll be able to ask, like, tell me about your mental emotional curriculum, like talk to me about that, and that way you can really start to juxtapose, okay, this school does it this way, this school does it this way, and see what fits for you. So with that, I am going to thank you all for coming. Thank the alumni for being here. I really appreciate you taking time out of your busy practices and out of your lives to spend some time with us here. So with that, the schools are in drop-in sessions now. So if you do have some school-specific questions, you should have that list of links that was sent to you earlier. But the schools are over there if you do have some additional last kind of parting questions before the day is done. So with that, I thank you all for coming to our virtual events, and wish you all the best of luck on your pathways. Thank you.